We are Clarigent Health. We have been listening, and now we are responding with a new solution to help save lives. We are bringing science to mental health to help save those lives. We are empowering the mental health professional with better insights and progress trends by using natural language processing and artificial intelligence to enhance listening and understanding. We truly believe that what gets measured gets better managed. Speech is the most complicated thing we do as humans. The brain, along with the muscular and respiratory systems, are used to produce speech. The vocal biomarkers in our technology are used as a non-invasive method to detect diseases through the use of speech characteristics. Research has shown that many factors, including mental health status, influence speech production that can be detected and measured. Speech is composed of aspects that we cannot consciously control, providing a window into our underlying emotions. Clarigent Health has developed Clarity, a decision support tool that measures these vocal biomarkers and other evidence-based assessments delivered as a mental health radar. By intelligently triangulating mental health metrics that come from the patient, the clinician, and now Clarigent Health's vocal biomarkers, Clarigent Health delivers the right data at the right time to inform the right decisions. Clarigent Health Clarity is a decision support tool designed to support and augment the clinician. In practice, the Clarity capture can be used on a clinician's mobile device or their desktop. And with the desktop, the app was designed to work alongside any telehealth solution to capture the data. The Clarity Analyze transforms client speech and patterns into vocal biomarkers, including not only what, but also how it was spoken. The Clarity Desktop Report allows a clinician to view consolidated data to guide diagnosis and treatment. Now let's take a look at this in action. Leah Johnson is a client of Diane that she is seeing remotely using a telehealth tool. Diane is using Clarity to get deeper insights on her therapy sessions. She uses Clarity to reflect back on the session and uncover insights that can aid in diagnosing and guiding treatment. Leah is frustrated that she is not feeling better and wants to understand why. Diane opens up Clarity, and it can easily run alongside her telehealth tool. To begin the session, she simply selects Leah's name and clicks Start Session. At the beginning of each session, she's reminded to ask permission to record, and the confirmation is saved by the app. As Clarity starts listening, Diane probes her on her hope, secrets, anger, fear, and emotional pain. This only takes about 6 minutes, but Diane knows that there's a lot more going on behind the scenes at Clarity, as it analyzes the speech characteristics to identify vocal biomarkers that could uncover her suicidal risk level, and provide an amazing set of vocal analysis details that will help Diane better understand the therapy that took place. What better way to gauge progress than with a tool to provide a formative assessment as therapy is happening? Once the therapy session is ended, Diane signs off with Leah and completes her evaluation. She has found this extremely helpful to track her clients' mental health states over time. Diane uses it to look back and reflect on when distress or crisis started or when there is a sudden shift, and then begin to identify patterns of behavior or mental distress. First, Diane enters her impression of Leah's overall distress. She indicates that Leah was moderately distressed. In Clarity, Diane has the ability to measure many mental health states. For Leah, since she was previously diagnosed with major depressive disorder, she focuses on depression and, of course, suicidality. But she also has options to note if she observed aggressiveness, anxiousness, and traumatization. Diane uses a scale from mild to extreme for depressed. She selects considerable. The same type of rating and observed symptoms is done for suicidality. Before the session was over, Diane scheduled an additional session to focus on the issue of moving to New York City during COVID outbreak. As a final help to make sure Diane captures key moments, she can record or type notes. Clarity was developed to inform clinical decision-making that can help prevent crisis, identify struggling clients who may have been missed, and empower therapists with new insights. Now in the Clarity dashboard, Diane reviews the results, and she has quick access to all of her clients. She is currently treating 11, and she can see how they fall for suicidal risk according to the vocal AI, her impressions, and from the Columbia she has her clients take. What is interesting is that the vocal AI is picking up on some potential risk for a few of her clients that she will want to focus in at their next session. Diane always clicks first on the suicidal risk button. This gives her a composite of her clients that either the AI, her clients, or herself believe there is a suicidal risk. She calls this her safety net. From looking at the list of those 6 clients, she can see who they are and why they fell on the suicidal risk list. She then likes to look at her clients that are increasing in overall distress from their prior session. She believes tracking these trends can head off bigger problems later. She can also take a look at specifically who the vocal AI categorized as high risk, how they rated themselves, and how she thought they were that session for risk of suicide and overall distress. Now that she's reviewed the summary data, she decides to take a look into Leah's specific results. The client progress charts what the client perceived alongside the clinical impression over time. For suicidality, the vocal analysis is also charted. Clarity provides these trends for suicidality, depression, anxiety, and overall distress. Looking at suicidality, there is a suicidal risk that seems to be present in Leah's sessions as indicated by the vocal AI. For Diane, she is thankful for this and makes sure that she focuses on this at her next session. Now, looking at a specific session, Diane can focus on the risk measurements, review what action was taken, and as a bonus, pull some smart phrases that were derived from the captured data to supplement her progress notes. As Diane digs deeper to uncover more insights, she is curious about the vocal analysis. Clarity provides a great word cloud to help her reflect back on what Leah talked about the most. Interesting. The words home, quarantine, and Natalie, her best friend from her hometown, was mentioned most. Diane can also review the conversation statistics to help her uncover if Leah may have been less engaged that session or possibly more talkative. And the sentiment analysis, Diane sometimes uses this as a great conversation starter on the next session. And now, going to the tab for the most impactful words, these are the words or phrases that most influence the vocal biomarkers for suicidal risk. Boy, is she happy. Clarity is quantitatively analyzing this, as she can see these are not words that she would obviously key on. And lastly, to have Leah's specific assessments easily accessible, give Diane a window into her client's state of mind on that session. Diane loves the safety net that Clarity provides. She feels so much more proactive rather than reactive with her clients. She truly believes Clarity will help her prevent crisis, save lives, to guide better outcomes.